Hey guys, it's Marshall with PhysioU. I'm here with Sean, and today we're going to talk about cervicogenic headaches for your mentoring minute. So, headaches in general are very common. Up to 96% of people experience it at some time in their life, with cervicogenic being anywhere from 1 to 20% of those, depending on which article you read. If we talk about whiplash patients, up to 53% of those patients experience a cervicogenic headache at some part. If we talk body chart, right, primary locations as unilateral as a key finding, anywhere being posterior, lateral, or frontal. When we talk about our objective exam, there's two studies that talked about cervical flexion, cervical flexion rotation as a diagnostic factor for including cervicogenic headaches. And what they found was a loss of 10 degrees to that side of the headache is a risk factor or a prognosticator for cervicogenic headaches. So the nice thing is we can treat that. So if I take Sean here, full flexion, I can use my belly to help hold him there, rotate towards that side, making sure I don't lose the side bend. Right? Here. I realize that's stiff. Right? Go ahead, Sean, push your head towards the right into my finger. So kind of like a contract, relax, push, 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 and relax. And I can take up more range to stretch. The other objective findings that correlate with cervicogenic headaches is palpation to OC1, C1, C2, or C2, C3, any of the upper cervical segments. A nice study that looked at treatment options, Gwendolyn Joel looked at therapeutic exercise group versus a manual therapy group versus a control. And what she found was the manual therapy group, which got mobilizations and manipulations of the upper cervical, versus the TheraX group, which got deep neck flexor training. So Sean, we're going to tuck your chin in here. And hold your head there. Just hold it there. You're just barely holding it off the pillow, as well as postural changes. That was the TheraX group. Both groups had significant improvements in their headaches compared to the control group, which is nice. When it comes to home exercise program, JOSPT put out an article that looked at cervical snags. They used a small strap, and here we'll just use a towel, pillowcase, right? Found an NDPT clinic, and they just placed it at that OC1 or C1, C2 level, and then opposite arms down across your chest, kind of just holding it stable, and the other one's kind of pulling in line with your chin and your nose, and pulling into right rotation, and then having the patient turn their head as well. So it's active as well. Hold it for 3 seconds, and then just repeating multiple times. And nice thing is the outcome of that study was it showed improved pain, improved range, and decreased headaches, right? Which is always a plus. Hope you guys learned something, and I'll talk to you next time. Bye.